Hi, this is Dr. Poole, and this is a brief presentation on the pathology of salpingitis. Acute suppurative salpingitis may be caused by any pathogenic organism, and in some cases more than one organism is involved. These tubal infections are a part of pelvic inflammatory disease, which has been described earlier in the course. Gonococcus is the causative organism in more than 60% of cases of this disorder, with chlamydia being responsible for many of the remaining cases. However, other organisms may enter the tubes via lymphatics or blood vessels, especially after an abortion or pregnancy, such as streptococci, staphylococci, coliform bacilli, and anaerobic bacteria. Gross examination may reveal a swollen erythematous tube with a luminal and/or serosal purulent exudate and fibrinous adhesions. Ovarian involvement can also lead to a tubo-ovarian abscess. Microscopic examination is what you'd expect. It reveals a neutrophilic mucosal infiltrate, a fibrinopurulent luminal exudate, and in severe cases transmural inflammation extending to the serosa or serositis. In this gross image, you can see the tube is swollen and has a dark brown-red erythematous appearance. The lumen is filled with liquefactive necrotic material. The lumen is filled with pus or fibrinopurulent exudate, or elegant term. And there's a marked neutrophilic mucosal infiltrate in the fallopian tube fimbria. Actinomyces israelii, an anaerobic gram-positive bacterium, is a rare cause of salpingitis, which can be related to the presence of an intrauterine device. Again, ovarian involvement can result in an ovarian or tubal-ovarian abscess. Tuberculous salpingitis is rare in the United States, accounting for not more than 1 to 2% of all forms of salpingitis. It is more common, however, in parts of the world where tuberculosis is prevalent and is an important cause of infertility in these areas. As you might anticipate with tuberculous salpingitis, the lumen is filled with caseous necrotic material, and typical tuberculous granulomas can be found involving tubal plicae. So not much new here with the pathology of salpingitis. We're just taking the same general pathology principles of inflammation and applying them to a different organ, this time the fallopian tube. Thanks.